My name is Bronwyn Penny. I'm an exercise physiologist and the Lifestyle Programs Manager with Diabetes Australia New South Wales. The BETA program was actually something that was designed by myself for exercise professionals such as personal trainers and exercise physiologists.
Whoa, hello, well done.
It's an education program about diabetes and exercise and how to suit the needs of somebody with diabetes or people at risk.
Where you go?
From some of our research that we looked at, we know that a lot of people with diabetes are exercising in a gym environment under the care of personal trainers. The problem with having personal trainers is that their understanding of diabetes is not necessarily at a level that provides a safe environment. So the trainer training program covers some of the severe complications, so hypoglycemia, exercising with high blood glucose levels as well, so hyperglycemia, and also looks at some of the long-term complications that can affect people with diabetes, and that will in turn affect their ability to exercise safely.
Where you go? Keep it up. You got a minute there?
There are some programs out there that do similar things, and so there are a lot of gentle exercise for older adults. But all the research and evidence base suggests that people with diabetes are actually more than capable and safe for doing higher intensity physical activity, and that they actually get better results in terms of blood glucose control and diabetes management. So our program combines aerobic physical activity and quite heavily loaded resistance training.
How's that feeling, alright?
The other difference between this program and a lot of the other programs is that it's underpinned by a behavioural change approach. So initially when somebody comes along to do the program, they're actually involved in an initial physical activity consultation, which does not only looks at their health status and those types of things, but also discusses their goals, their barriers to exercise, because we know that people will get better results when those aspects are included as part of a program.
This leg has to be free, like this, it has to be standing free. You can wobble, but the moment you start to jump around, you're out.
We actually piloted the program just to see how effective it was at a few different sites, one of which was Bundanoon at the Solar Springs Health Retreat, and we had some really, really brilliant results down there.
When Diabetes New South Wales approached us about doing the program, I initially thought, where are they going to find 24 diabetics in Bundanoon? We're just a little village an hour and a half south of Sydney with 1,500 people. And I was just so surprised at the initial information session that we had that there was 50 people turned up. So it was just incredible that just in a little community like ours, there were so many people that we could potentially help.
Away we go.
We started with 2 groups of 12 participants meeting twice a week for 12 weeks. And because that was so successful, we've continued those classes on a regular basis.
And 2. Last one. Have a rest. No, we won't. Stand up. Have a rest.
Before I did the program, I knew that diabetics had a problem with their blood glucose levels to do with lack of insulin production, but I didn't know that there were so many different complications. So what the program taught us initially was all the complications that may occur. Also, we looked at exercise contraindications, because there's some things that diabetics can't do.
And then put it up a bit more, so that'd be great.
We learnt that they have conditions such as peripheral neuropathy, which is a lack of sensation to the feet. So we have to be really careful where they place their feet, because we don't want them to trip or fall. The other thing, because many diabetics have heart conditions, they might be on medication that lowers their heart rate or lowers their cholesterol. So we can't measure their heart rate as we would in a normal class to see how hard they're working. We've got to use a scale of perceived rate of exertion. The great thing about the BETA program is that it is affordable because it's a class situation, so that you're not paying exorbitant personal training fees. It can be done in any facility. It can be done in a hall, as long as the facilitators have Dynabands or small little hand weights. Do some bicep curls.
When we actually deliver the training package to personal trainers, you have to have your Cert 4 personal training certificate. It's delivered by accredited exercise physiologists, accredited practicing dietitians and diabetes educators, so they're getting all those aspects when they come along to a training program.
The program has been extremely successful. We did quite thorough testing before the program, both clinical testing and also functional testing, and the results have been fantastic. We not only have seen a lower blood glucose level, also exercise helps with weight management, and weight loss is particularly important to diabetics. If they can manage their weight, in a lot of cases, they can manage their diabetes.
Excellent.
We have a participant, Grant, who has had fabulous results. His blood glucose and his blood pressure have both dropped, and his aerobic fitness has increased.
Well, certainly, the HbA1c's dropped down from 8.9 down to 7.3. My insulin doses were increasing, and now my insulin doses are decreasing. So as my control is improving, I may even be able to drop some of the medication as well. The greatest thing is I'm now much more motivated to actually get out and do the exercise. So I now walk 4 to 5 days a week. I'll do some of the exercises that we've been shown to do at home. And I'd looked at joining gyms before in the past, and I guess my problem was that you feel inadequate when you look at the bright young thing. So I think coming here with a like group of people, that was great, because everybody's in a similar situation, so we're all motivating each other.
The other aspects that you look at is the social and emotional health and well-being. So they're things that you can't always necessarily quantify through a physical activity test. So we did an SF36, which is just a general health and well-being survey, and we showed some really, really dramatic improvements in the quality of life that people experienced after finishing the program.